Greetings, my friends. This is Dr. Jaime Daniel, and welcome to my show. Today, I want to talk to you about growth plate injuries. The growth plate is the area of tissue near the ends of long bones in children and teens that determines the future length and shape of the mature bone. Each long bone has at least two growth plates, one at each end, and they are longer than they are wider. For example, the femur, radius, the ulna, and the metacarpal bones are long bones. Once your child's growth is complete, the growth plates close and are placed by solid bone. The growth plates are weak areas of your child's growing skeleton because they are even weaker than the nearby ligaments and tendons that connect bones to other bones and muscles. Growth plates are vulnerable to injuries. Injuries to the growth plate can result from a single traumatic event, such as a fall or automobile accident, or from chronic stress and overuse. Children and teens with growth plate injuries often need immediate treatment to prevent problems with bone growth. However, with proper treatment, most growth plate fractures heal without any lasting effect. Because the growth plate is the last area of bone to harden during growth, children and teens are vulnerable to growth plate fractures or injuries. A similar injury in an adult can cause a sprain. There are some factors that may increase the chance that your child or teen may injure or fracture their growth plate. Growth plate fractures occur more often in boys than in girls. A girl's body matures at an earlier age than boys. As a result, girls' bones finish growing sooner, and the growth plate is replaced with stronger, solid bone at an earlier age. Growth plate injuries often occur in children and teens who participate in competitive sports or activities that increase the risk to fall or be hit, such as football, basketball, gymnastics, biking, sledding, skiing, skateboarding. Specializing in one sport and overusing certain limbs or areas of the body before puberty finishes can lead to growth plate injuries. The Salter-Harris is a classification system that divides most growth plate injuries and fractures into 5 types. But first, you need to understand the anatomy of long bones to help you understand the types of growth plate injuries. The long bones have 4 major areas: epiphysis, which is the end of the bone near the joint; physis, which is the growth plate; metaphysis, the area between the growth plate and the shaft; and diaphysis, it is the shaft of the long bones. And talking about the Salter-Harris, it has 5 types. Type 1 happens when the fracture passes through the physis but does not involve the area of bone around the growth plate. Type 2 happens when the fracture runs through the physis and the metaphysis. This is the most common type of growth plate fractures. Type 3 happens when fractures run through the epiphysis. This leads to a separation of the epiphysis and the physis from the metaphysis. Type 4 happens when fractures run through the physis, metaphysis, and epiphysis. And type 5 is a compression fracture through the physis that happens when the end of the bone is crushed and the physis is compressed. This type of fracture is rare. When your child got a growth plate injury, he might experience things like a persistent pain and tenderness after a sudden or overuse injury, a deformity, warmth or swelling at the end of a bone, changes in how he is bending their limbs, or inability to move, put pressure on, or bear weight on a limb because of pain. You may notice that your child self-limits the amount of time playing after a prior injury. Growth plate injuries can happen for many reasons. A sudden accident can cause growth plate injuries. For example, your child may experience trauma to the limb from a blow or falling down, or they may experience such injuries from competitive sports or recreational activities. Sometimes growth plate injuries happen when your child overuses a certain part of the body. Young children who specialize in a sport or activity and spend long hours training can overuse a specific limb or area of their bodies, causing growth plate injuries. This may be seen in gymnasts who practice for hours, long-distance runners, baseball pitchers. Although most growth plate injuries happen during play or athletic activities, growth plates are also susceptible to medical disorders that can alter their normal growth and development. You need to remember, growth plates have not yet hardened into solid bones. Neither the structures themselves nor injuries to them shows up on X-rays. Instead, growth plates appear as gaps between the shaft of a long bone and the end of the bone. Therefore, a growth plate injury may not be apparent on an X-ray. This is why you might be asked to get some magnetic resonance imaging, computed tomography or an ultrasound, because these tests enables to see the growth plates and the areas of other soft tissues and help to visualize the injuries and determine the type of growth plate injury. About the treatment for growth plate injuries, it depends on the type of injury. The treatment should start as soon as possible after injury and generally involves things like reduction of fracture and immobilization. Here we can find things like closed reduction and open reduction. The treatment will depend on the type of injury, and sometimes it might require surgery. But if the injury is serious or the treatment is delayed, the growth plate fracture can interrupt the normal growth of the bone. The bone may be cracked or slightly longer or shorter than expected. And to help prevent problems with bone growth, probably you might be recommended a follow-up appointment to monitor the bone for any changes in growth and development. And after the wound has healed, you might be also recommended to do some exercises to strengthen the muscles that support the injured area of the bone after the injury has healed. Remember that strengthening can help improve your child's ability to move the joint in the way that it should. Well, I hope you enjoyed this episode, and we will see you in the next one. Thank you.